Hello.
Hello. If you recognize your name, because probably I've spelled it wrong.
Yes, my
Hello.
name is Dokhyun Han. Thank you for introduction. I'm so pleased to have a chance to have this live demonstration chance here in this really beautiful meeting. Today's topic is about the stone breaking strategy for large hard calcium stones. As you know, the breaking stone by laser is very straightforward, but depending on the strategy, the outcome can be different. In this case, I will start with dusting and move to fragmentation, and finally will be the pop dusting using high power laser up to 80 to 100 watt. And first, I want to introduce my surgical team. Dr. Pang, Sokwan Bang is my first assistant. He's a third grade resident, very excellent resident. And our nurse, Youngmin Lee, is our scrum nurse. She has been working with me for several years. And our super excellent circulating, Haejung Kim and Eunjung Park. Yes, let's move on to the operation field. And first, I want to show my setting for operation. For this is a fluid management system. It's a kind of pressure bag, but it can maintain the pressure of saline, although the volume is decreased. And then,
You have more.
can you see this chair? I think it is very. I love this chair. I always do RIRS in sitting position, and this arm is very important for my ergonomics. I always land my elbow under the arm, so it is very easier for me to do long time operation or many operations in the same time, in the same day.
Again, the strategy would be to treat both kidneys in one session. Is that right?
Yes, I will do left side first. That has bigger burden, and then I move to right. But in this live demonstration, I will show you only left side because of time limitations. As you can see, the status of ureter is very nice. There is no evidence of stricture. There is a real narrowing at the UPJ, but I don't think it's problematic. And because the guide wire is a little bit retracted, I will reposition the guide wire. Visualization of collecting system is very important. And guide wire. 테이블 조금 내리자. Now the guide wire is okay, and I will place the ureteral oxygen sheath. There is 11-13 French and 46 centimeter. My routine length for male is 45 or 46 centimeter.
Did we get right? It's a 13 French outer sheath?
Yes, 13 French outer sheath. I think this case I can place 14 French, but I think 13 would be okay for nice operation. If I need bigger oxygen sheath, I will consider, but I want to start with 13 French outer sheath.
This sheath went up very nicely. Did you, was this, in the slide said the patient was not pre-stented. Was the patient finally pre-stented before surgery?
No, pre-stenting is not routine in my practice. I didn't do pre-stenting in this case. And actually my concern was that this patient have a history of open ureteral lithotomy around 25 years ago. So I had a concern, but there is no problem. The ureter is very nice now, and great. The tip of the ureter oxide sheath is little high, so I will reposition the location. I think this location is okay for nice irrigation, and my first step should be the navigation of the collecting system. As you know, this is the renal pelvis, and there might be 4 medium-sized stones around 1 centimeter or 1.3 centimeters, and good. And this is the way to the upper calyx. Oh,
Dr. Han,
hard. Yes.
which scope do you use now? The image is very nice.
Yes, I use very beautiful scope, URF V2, that has an outer diameter of 8.4 French, and the video scope, as you know. Diffraction is. Yes, as we know from the CAT scan, there are many smaller stone fragments here, and maybe I think the upper pole would be largest, and I will decrease the size of the stones, and I will put the fragments into the upper pole. Is my plan. Yes, laser fiber, please.
So your strategy would be to break the stones and basket them, or you will do dusting?
I will just dusting, but for sampling for stone analysis, I will catch some fragments. But my plan is dusting, mainly dusting, because stone burden looks large. I don't basketing, as you know, takes so long time. So my laser setting first is 0.2 joule and 40 hertz. I think it would very weak for this large hard stone. As you see, dusting is not so easy. Or making older stones to powder is very hard. So I will try to reduce the stone burden first, and there would be many medium-sized fragments, just like 5 milliliter or 3 to 6 milliliter fragments, and then I will try to put the fragments at the upper pole, and then I will do popcorn technique. If it is uric acid stone, it would be more easier, as you know, to make all the fragments to powder. But in this kind of calcium stone, it is very hard. I always start with this low power laser, low pulse power laser, because if there is some bleeding from the initial stage, it would be very hard for me to continue the operation, especially when the stone is very big or the burden is not so small. So we'll keep this power, and then according to the situation, I will increase the power for the enhanced efficacy, time efficacy. Now I change the position to Trendelenburg down position. That means head down position to make the upper pole more dependent. I should move to this stone first.
What surgical time for both sides did you plan for today? So what is your expectancy for the procedural time?
Our burden is not huge. Our trend are not so huge, but not so small. I expect 30 minutes and maximum 1 hour at the left side. For the right side, it would be less than 30 minutes. I expect the stone breaking efficacy. In this stone, the dusting is okay. I satisfied, but uh, to show more during this limited time, I wanna enhance the power. 0.4로 올려주실래요? Now I increase the pulse power to 0.4. You can see some change. Is more powerful, but the dusting nature is okay, still okay, I feel. And not painting. I will wanna go into the stone core and I wanna make more frag, not just dust.
So I just asked, it appears that you want to cut the stone in half to,
Yes.
or is that a
Yeah.
wrong perception?
My first goal is put the stone into the upper pole as a fragment. So to achieve the goal, I wanna divide the stone, not just dusting. And I changed my goal to make the stone pieces. And I think I need more power. So 0.6에 50으로 올려주세요. Just I increase the power to 0.6 joule and 50 hertz from 40 hertz.
Okay. Which is the make you're using? Which is the company?
Yes, Lumen is one.
Lumen is one.
Yes,
okay.
yes.
Is it the big one with the force flash lamps, or is it the latest version, the huge laser?
This is a conventional 100 watt machine, and it doesn't have any specialized. You cannot control the pulse power or any specialized setting, and
we can see that you are using the red pilot, the aiming beam. Do you think it's necessary to keep the beam? Because we can see that it creates some over illumination.
Yes, thank you. Thank you for your nice comments. 우리 에이밍 조금만 줄여줘요. The upper pole size, upper calyx size is a little smaller than I expected, but it is okay, I think. And I want to put this stone together to the upper pole, but it looks hard to move by the scope, so I will use the basket and 2.2 French, 2.2 French basket. When I try to move the stone, I think it is very important to understand the size of the loop. If I use the smaller basket for the movement of the stone, it would be very hard to let the stone I mean that catching stone is easy, but detaching would be difficult. So now I'm using a bigger diameter basket to have bigger group for stone grasping and releasing. Open. 천천히. Okay. Close. Great. still big to put the stone to upper pole. Open. 완전히 open. Close. Yes, sir. 됐어. Open. 됐어.
Which is the
Close.
size of your extraction zero tip? Is
Yes,
it
the out-
5.9 or
the shaft diameter is 2.2 French, and the roof diameter is as I know 1.5 centimeter. Oh, the time is too limited, so I wanna move on to the next step.
so
Yes.
the surgery is now going for 20 minutes, your lithotripsy, and you have quite achieved a lot of lithotripsy already. How long will you continue the surgery today as a one-stage surgery? Because have to end your transmission in 3 minutes. So for how long will you be treating the patient today? Have you set yourself 1 or 1.5 hours, or what would be your treatment time today?
I think I can treat all the stone today, and I want to show you the high power popcorn dusting, and I will increase. I increased my power 1.0, but I will increase it to 1.5. 1.5로 올려주실래요? Now the power is 1.5 joule and 50 hertz, but in this kind of hard stone, it is still very hard to break the stone, make the stone powder. However, if I spend time 5 minutes, it would be the outcome would be different. I think 2.0로 올려주세요. 2.0 joule and 50 hertz now.
So that is a high power popcorning, what we see at the moment.
Yes, yes. Actually, without this power, it is very hard to make this hard stone to small fragments. When the stone fragment is a little bigger, the laser fiber damage would be higher. So first time I am very careful like this. However, after the stone fragments became smaller, I will continuously lasing. Can you check the water pressure?
How much frequency are you using now?
50 hertz now. The maximum hertz with a 2.0 joule.
I think it's interesting to see what we mentioned before, that you are using very high frequency, but we can see the laser emitting time. You have to stop, come back, stop, come back, stop. There's also another possibility to reduce the frequency, maybe to 20, but you don't stop.
Aha, yes. The reason why I have high frequency is that that's not only for the hit the shut the laser more faster. With the higher frequency, the popcorn effect tends to be higher. It is my impression because of the retro person is more effect can be enhanced. So and to increase the chance to hit the stone during the popcorn technique, I also increase the frequency to maximum hertz. I agree with the idea. If I should stop the lasering, I should consider low frequency, but the purpose is a little bit different.
That is, I think we will in the future we will have to learn more on how to really use the full range of high power instruments, and I think we will need to have the optimal settings in the future for these high power machines. Our transmission with you unfortunately is now over, We thank you for your nice demonstration.
Yes, you can see the stone is already become very tiny, but after 5 minutes later, it would be better. I can get better outcomes. And thank you for your nice comments, and I really appreciate all the members of SIU and KES members to do their best to support this nice event. Thank you, thank you.